All right, so we're here
All
with Lisa Vuich and patient one, Lorraine. Excited to tell
This
us.
is the after. This is the after. We just spent a couple hours in a chair, getting a few threads and needles, and it was not
and PRP.
PRP, a little injection. It was great. What's really great is the difference. This is the before side angle picture.
Mm-hmm.
This is the after. That is completely different.
Yeah,
So
completely different.
Amazing.
So Lisa, tell us a little bit about what you did, just briefly, and then as far as the procedure goes.
So the procedure involves placing the mint PDO threads in various regions of the face. What you see initially is an amazing change in contour, but it's actually not even the full lift, that occurs. The where it settles, maybe over the course of 12 weeks, is really more like where you end up. But it's amazing that you get both instant gratification and then it keeps getting better over time. So that's the magic. This is why it's so gratifying to work with these threads and to perform this procedure, because most people, I think if you would agree, would think that you could not, I'll just kind of hold this up, most people would think you could not go from this jawline to this jawline in a few hours with PDO threads. And the reason you can do this, obviously, is very much technique. It also speaks to the strength of the threads, to the pull of the threads, to the design of the vectors, of the pattern. So all of this, you can't just get threads and just shoot them in and think you're going to achieve a lift like this. You have to have the right training. You have to be using the right threads, the right patterns for sure. But, most people, I think, wouldn't think you could go from a jawline that's getting muddied. And you said that your biggest bugaboo was
my neck.
That's mine too, actually. So to be able to go from this, in a couple hours to this,
I'm blown away. I'm going to be honest. I'm blown away. And I'm going to drive home from Miami. I feel great. There's no, it's.
So Dr. Lisa said, so your neck bothered you. You honestly look 20 years younger, Lorraine. You really, really do. So how do you feel? How was the whole procedure? So you were there for almost 3 hours, right? 2.5, 3 hours. So
we took a break.
We took a couple breaks, and also we were doing a training, so we were talking, and Dr. Indra, who was here for the training today, was also getting her hands-on experience. So in a real office, it would go a little quicker, but we never expected in a training to go as fast as when someone is, quicker and more comfortable with the procedure. But you did great.
I was numb. I felt comfortable. It was a very, very all-around great experience, actually.
So one of the things we try to explain to potential patients is that this is not surgery. That it's really a non-surgical technique that is really no more invasive than filler, which we do all the time. It's just very different. It's technically, a more challenging procedure, but with the right training and with the right threads, you can absolutely achieve a lift for your patients without buying an expensive piece of equipment either. That's the amazing thing. This is more than skin tightening, and that's, without something to reposition soft tissues, you can't get a lift like this. So that's what makes it so gratifying to do these procedures.
One of the things I felt like you really knew the anatomy of the face, where all the structures were, the vessels. When you were doing your teaching, I could hear you explaining, you want to avoid this, you want to steer clear of that, you want to go here, you want to go there, and how
and depth,
and what that feels like when you're doing it. So that was pretty.
So you really did. You're walking away with a surgical result, and you're literally walking away. No downtime. You're going to drive home.
Table 5 minutes ago.
Dr. Vuich, what would this procedure cost?
The cost of thread lifting depends on how many regions we're doing, which speaks to how long the procedure is going to take, the complexity, of the threads. But if we're doing a, sort of top to bottom full thread lift like this with platelet-rich plasma, which adds a whole nother dimension of regeneration, then we are usually in the $3,800 to $4,200 range. Now that's a third of what a facelift surgery would be, and a few hours and not. The nice thing though too about this, first of all, most people are not up for the whole surgical thing, but the restrictions after this, there are restrictions. There are absolutely activity restrictions, but you're not wearing a strap around your face, and you're not, it's less than post-surgery. It's less discomfort than post-surgery, and it's something you can maintain over time by, doing some booster threads every 1.5 years or 2 years even, if you've done a lot. So again, I'd say you're in the $3,800 to $4,200 range for a more major procedure. If that's too high for the budget, then you just break it up and you don't do every region at once. Maybe first you do your brow lift, and then 4 to 6 months you do your cheeks, and then 4 to 6 months later you do your jawline and upper neck. You can spread it out. You don't have that luxury with surgery. You can't say, well, at 12,000, how about we do 3 sessions of 4,000? It doesn't work like that, right?
Sure.
You either got to do the big thing or not. So we're fortunate today with the training to be able to do a really nice correction for you. And
Oh, I'm very fortunate to have been part of this whole process. It was amazing.
Well, you look great, and it definitely looks like a $10,000 facelift if you ask me.
Maybe
And
14.
From 1 to 10, Lorraine, how you feeling?
11.
Awesome. All right. Well,
11.
cheers. Thank you, Dr. Lisa. Thank you,
Our
Lorraine.
pleasure.
And if you want to learn more about training for these types of procedures, visit specialtymedtraining.com. If you're a patient and you want to get this magical, beautiful look, visit renewmedspa.com. All right. Thank you.